Good evening. Thank you for your patience, and welcome to the first Longwood Seminar of 2011. We've had an absolutely overwhelming turnout tonight because of our guest speakers, so we're thrilled about that, but I'm sorry we're starting a little bit late. I'm Gina Vild. I'm the Associate Dean for Communications and External Relations at Harvard Medical School. And tonight, you are here for the Race to Grace, Surviving Stress, with 3 expert Harvard speakers. For those of you for whom this is your first Longwood Seminar, we're delighted to have you and hope you'll register for future seminars, and we'll see you back this year and again next year. For those of you who have been here before, welcome back. This year, for the first time, we selected our topics for the seminars using our friends on Facebook. So if you are a Facebook friend of ours, thank you for voting. We had hundreds of people vote on the selected topics. So in addition to tonight's seminar, we have 3 others that we encourage you to register for. We have some limited space available. And those are on March 15th, Living Long, Living Well, Aging with Flourish, which received the most votes of any of the seminar topics, with tonight's being a close second. On March 29th, we have From Vision to Touch, Exploring the 5 Senses. And on April 12th, Food for Thought, Genetically Modified Nourishment. So just very quickly, a few key announcements. We are videotaping this program. So if you have friends or relatives who are unable to attend, it will be soon on the HMS website. And I also mention that because you may, if you are in one of the first few rows, you may inadvertently wind up in the video. So if you're not comfortable with that, I want to say move to the back, but there's no back to be moved to. So we do have a television in the lobby. Also, we want you to know that if you attend 3 or more of the Longwood seminars, you can receive a certificate of completion. If you attended 3 or more last year and did not receive your certificate, please talk to one of the members of our team who are in the lobby. And finally, if you are here because you'd like to receive continuing education credits, you can receive these by attending all 4 of the seminars and completing an evaluation. So please, again, register in the lobby. And finally, the obligatory reminder to turn off your cell phones. I'd also, before we start, I'd like to congratulate Katie DeBoff on our team. I don't think she's in this room right now, but this is her inaugural Longwood Seminar, and it's a great success. So Katie, wherever you are, thank you. And now tonight's program. Tonight's seminar is The Race to Grace, Surviving Stress. And I can tell you, having spent only 10-15 minutes talking with our speakers, I feel greatly relaxed and stress-free. At one time or another, everyone feels stress, whether it's about a health issue, a job, family, or friends. We're often looking for effective ways to manage stress in our lives. We're fortunate to have at Harvard Medical School some of the world experts on stress, and even more fortunate to have 3 of them here with us tonight. First, Dr. Sarah Lazar, who is an associate professor in the Department of Psychiatry at Massachusetts General Hospital. You may have seen her research has been widely covered in the press recently. She's also an instructor in psychology at Harvard Medical School. Dr. Michael Craig Miller is also with us. He's an assistant professor in psychiatry at Beth Israel Deaconess Medical Center and an editor-in-chief of the Harvard Mental Health Letter. And for those of you who aren't familiar with the Harvard Health publications, I urge you to visit our website and find them. It's really a wonderful wealth of information. But first, you'll hear from Dr. Darsham Mehta. Dr. Mehta is medical director of the Benson Henry Institute for Mind-Body Medicine at Massachusetts General Hospital. He's also an instructor of medicine at Harvard Medical School. So thank you and welcome.
Okay. All right, well, thank you. Thank you for the kind introduction, and wow, what a turnout. This is, I wonder if this is a reflection of our times and we're just really stressed, or we are all going to be pioneers in this movement and really help really educate the community and the world at large about stress reduction. And so I just wanted to kind of frame, perhaps just provide an overview and frame our conversation a little bit around stress and stress reduction, and how, what the implications there may be, there already are around this topic as it relates, particularly as it relates to our health and well-being. So oftentimes, this is the first question I get asked in the clinic, right here. Doc, is it all in my head? And is it all in your head? And the question is, well, what is the difference between what is in your mind and what is in your body? And why do we keep them separated in some ways? And don't they intersect, and aren't they interrelated in some way? So a study done in 1964 by Dr. John Stokel, who some of you may know is one of the pioneers of primary care medicine, especially here in the Boston area. When he was at Massachusetts General Hospital, he did a study looking at, well, what are the types of visits in the ambulatory setting? And what he found was, in the outpatient clinic, between 60 to 90% of healthcare visits are related to some aspect of psychosocial stress. Now that's impressive, and if you think about when you go visit your primary care doctor or your provider, how often is some aspect of stress related to your visit and why you're there, and how often does it impact how well you may follow the doctor's, the physician's sort of prescriptions, how well you may listen to them, how well you're able to convey what you want to convey about your medical condition or about your symptoms at large. And this still continues when I interview or when I speak with residents and physicians today. This statistic, they say, "Wow, I think it's almost 100% of my visits." So what are some examples of conditions that have been shown in the scientific literature? And I'm just going to give you, this is just a really a brief overview of different conditions, and there is now increasing amounts of research on each one of these and more. This is just a snapshot. But for example, Dr. Benson's work, some of you may know Dr. Herbert Benson. He's a cardiologist, and when he first delved into this topic, he studied hypertension and found that when individuals learned a stress reduction technique, they were actually able to reduce their blood pressure by measurable amounts. Cardiac arrhythmias is another example. Chronic pain is a condition. Some of you may suffer from chronic pain conditions, and you may find that when you're under more stress, your symptoms are worse. And when you're under less stress, your symptoms are better. So the nature of the chronic pain is actually waxing and waning, and it may correlate with your sense of stress. Insomnia or sleep disorders or sleep difficulties, another example of a condition that is quite prevalent. For some people, medication side effects. For those of you taking medications, the way you experience the side effects of the medications, which are for many times it may be debilitating or may prevent you from doing the things that you want to do, they also are impacted by stress. Anxiety and depression, oftentimes we use the word anxious and stressed synonymously, but when you think of it as a clinical condition, clinical anxiety and clinical depression, they also correlate with individual sense of perceived stress. There are conditions for which we wouldn't call them diseases, but certainly debilitating conditions, or quite. So, for example, premenstrual syndrome is an example of a condition which correlates with stress. Infertility, again, another condition for which we don't really have much reason as to why it happens. Often, most cases of infertility are unexplained, and still, but yet it's still quite stressful to go through the process. And then finally, obesity. We are living in the midst of obesity epidemic, and we find that, well, I guess let me ask a simple question. How many of you, when you're under stress, you turn to food? And when you actually think about it, you turn to food. Or when you don't think about it, you turn to food. So there. So, well, what was some of the sort of language around stress and stress response was originally one of the first scientists to really talk about this at length in terms of, well, what are things we can do to mitigate the negative effects of stress on health? That was Dr. Benson, he described this as a term called a relaxation response, as a counter, it's basically thought of as the counter stress response. And what he saw in sort of studies that he had done with meditators, that he found that when individuals practice a mind-body approach, and he described it that this is the condition by which it's evoked. It's a repetition of a word, a sound, a prayer, a thought, a phrase, or muscular activity. And there's this passive return to that repetition when other thoughts intrude. So if you practice this approach, you find that you can cultivate a different physiology that actually has health-promoting aspects to it. And the condition by which this is evoked is that you have to break the train of everyday thought. And in his early studies, he saw that as little as 15 to 20 minutes, 1 to 2 times daily, was sufficient enough to really evoke some of the health benefits. And this was quite groundbreaking at the time because no one had ever thought that these mind-body approaches, which had been around for millennia in multiple traditions throughout the world, could actually have health-promoting aspects, and this was the first, one of the first. There have been many, many studies since then, which we're going to hear about today too. But this was one of the first studies to really examine this. So, what is mind-body medicine? And mind-body medicine, this is the definition from the National Institutes of Health, really refers to the interactions among the brain, mind, body, and behavior, and on the powerful ways in which emotional, mental, social, spiritual, and behavioral factors can directly affect health. And what it regards as fundamental is this approach that respects and enhances each person's capacity, and here are the two most important words, for capacity for self-knowledge and self-care, and emphasizes techniques that are grounded in this approach. So this is really my own contribution to my own health. That's what mind-body medicine really refers to, is what is it that I can do for my own health? And how can I cultivate those approaches? So what are some examples? And this is just, again, a snapshot. There are many others, but I just thought I'd highlight a few common ones. Meditation, deep breathing, guided imagery, biofeedback, hypnosis, yoga, Tai Chi, Qigong. Some of you may have practiced some of these approaches. Some of you may have practiced this in ways you thought were maybe just as part of exercise, but really many of these techniques have now shown to have physiologic consequences in patient populations that have known diseases, such as coronary artery disease and others. Well, what we know today is that mind-body medicine is really quite prevalent in the United States, and if anything, it is the fastest growing segment amongst complementary and integrative approaches amongst the United States population. So this is something that physicians and other healthcare providers cannot ignore how prevalent it is. In 2007, you can see that it really comprises of the top 10, it's in the top. It's 3 of the top 10, and it's also these are the ones that have the greatest amount of growth is between 2002 to 2007. So again, roughly it represents about 20% of our population has practiced some form of mind-body therapy or mind-body approach for their health and well-being within the past 12 months. And maybe in this population, given the interest, it must be a much higher, I suspect it's a much higher percentage, but this is just to give you a sense in the overall in the United States. So ultimately, what I want to sort of, what are mind-body techniques and stress reduction approaches, what do they allow us to do? And this is really about building resilience, and ultimately, resilience is what we hope to cultivate and as a way to really improve our own health. And there are multiple you will hear about some different types of mind-body programs and mind-body approaches, and they incorporate some aspect or many aspects of these or they may focus on different types of skill sets, including eliciting this physiology of the relaxation response, mindfulness, as a sort of a construct that we can cultivate, changing our cognitive beliefs, really improvement of our sleep. What many individuals and scientists who study mind-body medicine, what they postulate is that this is really the portal to really changing other lifestyle behaviors that we know are important for our health and well-being, including diet, exercise, and it allows us also to really, within the construct of these mind-body programs, other important aspects include humor and positive affect, which you'll hear a little bit about today, as well as social support. So you're going to hear a little bit about research. And I just want to give you some frame, there are many different aspects of research and some of the cutting edge research, which we are fortunate to be here at Harvard Medical School, and scientists have began, and some of them include really there are changes. You're going to hear a little bit about the brain at the brain level and really neuroscience, and then also at genetic and molecular levels there are changes happening as a result of these approaches. And this is really quite groundbreaking to think that changes can happen at such, these are demonstrated changes happening at such deep and intimate levels of our existence. I want to also just propose here, this is not also, when we think about healthcare reform, which is the topic, this is really a possibility or a way into thinking about how we might save costs in our healthcare system. And just to give you a sense of a study we were part of as a part of Medicare, commissioned us to look at our cardiac program, which incorporates mind-body approaches. And we found that not only does it decrease mortality, this is compared to a traditional cardiac rehab program. It increased time to re-hospitalization, but also reduced cost, almost $3,000 per beneficiary, Medicare beneficiary. And as a result of this study, there are new codes, billing codes that Medicare established last year. So these are really has power to change the way we think about healthcare. So lastly, just want to say that if we think about this equation, what we're hoping to do with MindBot is really decrease the numerator, or stress. Another term is thought of as allostatic load. We want to increase our resiliency factors and social support. And ultimately, what we hope over time is to really develop our own selective vulnerabilities or propensity to illness. Or if you think of the reciprocal of this, it's our propensity to health and wellness. And these approaches, Dr. Benson likes to kind of use this analogy, three-legged stool, which I actually appreciate. It finds that there are aspects to healthcare. There's pharmaceuticals, there's surgery or procedures, but this is the self-care piece of it. And this is the piece that we, again, can contribute to our own health. So with that, let me transition over to our next speaker. And it's Dr. Sarah Lazar, and as was already mentioned, she's an instructor in psychology at Harvard Medical School, and her focus in her research has been to elucidate the neural mechanisms underlying the beneficial effects of yoga and meditation, both in clinical settings and in healthy individuals. And one main focus, which you're absolutely going to really find fascinating, has been to see how yoga and meditation influence brain structure and how these changes influence behavior. She has been practicing yoga and mindfulness meditation since 1994 and is a board member of the Institute for Meditation and Psychotherapy. Sarah.
Good evening. Thank you all for coming out tonight. So, there's a lot of questions I get often about, well, what exactly is meditation? And I like to think of it, or one way to think of it, is that it's an active mental process. Because some people think, oh, you're just sitting there spacing out in la-la land. And generally speaking, when you talk to monks and whatnot, you're doing something very deliberate. A lot of people refer to it as attention training. So when you're sitting there, you're not lost in thought. You're either focusing your attention, because of course our minds like to wander, right? And so you might use a mantra, and that's how you keep your mind focused in the present moment, is to repeat a word over and over again. Or some people choose to use their breath. So just noticing as you inhale, noticing as you exhale. It's like, what are the sensations in your body? Can you notice your belly rising and falling? Can you notice the air flowing in and out of your nose? And just noticing it. It seems kind of boring, but just doing that helps calm down your mind and clear your mind and helps you just stay focused in the present moment. Some people use some sort of visualization. So sometimes you see these really elaborate pictures and they just look at the picture. And there's lots of different ways to meditate. And what's interesting is that there's been studies now, probably several thousand studies done with different types of yoga and meditation. And although they're all different, they all seem to produce very similar results. And that is sort of decreases in anxiety and depression and increases in many health benefits. So decreasing your cortisol and decreasing medical symptoms. Tonight, we're going to talk specifically about one very particular form of meditation, which is sometimes referred to as insight meditation. And this is a style of meditation that does not require mantra. It's just watching your breath. So watching your belly rising and falling. Or you can also do sounds. And it's very similar to Zen. I think most people hear about Zen. And this is very similar, but a little bit different. And again, you're not spaced out. It's very aware of what's going on. So as you're breathing in and out and noticing your thoughts, thinking, oh, this is boring, I can do this. What's so special about this? Sort of noticing those thoughts and not getting attached to those thoughts. A lot of meditation is about sort of being able to step back from your thoughts and seeing them as just thoughts, and that you loosen their power over you, that you can sort of, when you get angry at someone, say, just saying, oh, okay, well, I'm just feeling angry, but maybe, can I step back from that and just let the anger go and just go back to just watching my breath now? So again, so you're not lost in thought, you're not spaced out, you're not in a trance, you're just very aware of what's going on right now. And the key element of this is to have this non-judgmental attitude. So just aware of it and not, so for instance, if your foot falls asleep and it starts to tingle and not going, oh no, right, and not liking it, can you just notice the tingling of your feet, of the sensations in your feet? And so this non-judgmental awareness, this just being aware of the present moment and just letting it be however it is, that is mindfulness. You hear that term thrown around a lot these days. You have to be mindful, and that's what they're talking about. So trying to just be aware. So like if you hear a bird, just listening to the sound of the bird and not thinking, oh, I really like that bird, I wonder what that bird is, and not going, oh, that bird, I wish it would stop singing. Just notice the sound of the bird. That's mindfulness. Okay. It's not moving forward. There we go. All right. So now there's an 8-week class called Mindfulness-Based Stress Reduction. And this is so if you go to your doctor and you say, oh, I'm really stressed, and they send you to the stress reduction clinic, this is one of the ones that you might be sent to. And so it's an 8-week class. And during the class, you get education about stress and all the things it can do to your body. But you also learn how to meditate. And then you're given guided meditation tapes. And so you bring those home and you meditate every day on your own for 40 minutes. And there's been hundreds and hundreds of studies done, and they've shown that it decreases stress, it decreases your mind, like when your thoughts are always racing, that's rumination. So it decreases that, it decreases worry. It decreases the likelihood, if you have a history of becoming depressed, it decreases the likelihood of becoming depressed again. It decreases your activity to pain. So people who have a chronic pain, it helps you deal with your pain. And it can also, it slightly reduces the amount of pain you have, but more it's your relationship to the pain. People start saying things like, the pain doesn't rule my life anymore. There's also many positive side effects of meditating. So in addition to reducing stress, it also increases your ability to pay attention. Increases resiliency. So when things go wrong, you don't fall apart so easily. You're able to keep your cool and keep your calm. Number one thing people report is increased quality of life. They just enjoy life more. And this sense of well-being, like I'm okay, that increases tremendously as well. So that's great. So people say they feel better, but how does it really work? Is it just self-report? As Dr. Maida said, is it just in your head, or is there something really going on that's underlying this? Is there really something we can show that's really causing people to feel less stress and to feel happier and better about themselves? So we're going to talk today about behavior. So usually when you think behavior, you think about little kids, and if they're well-behaved, okay, that's good behavior, and if they start fighting with each other, that's bad behavior. But as a neuroscientist, you can also think of behavior of the mind. So if you're someone who tends to be anxious and to worry a lot, then we could say that the behavior of your mind is to be worried. Or if you tend to be depressed, your mind, the behavior of your mind is to be depressed. Or if you're an angry person, okay, that's the behavior of your mind. And as a neuroscientist, I'm a reductionist, right? So all these behaviors are based on brain activity, and brain activity is based on brain structure. And by this, I mean that somewhere deep in your brain, there's neurons talking to each other. And so for people who are angry, they have a pattern of how their neurons are connected to each other and how the neurons talk to each other that makes them more likely to get angry frequently, right? And so if you're depressed, there's a certain pattern of brain activity that makes you be more depressed. And if you go to your doctor and they give you a prescription for antidepressants, that's going to change your brain structure. That's going to change the number of receptors in your brain. And when you change that brain structure, that changes your brain activity, and then that changes your behavior, right? Your brain is no longer depressed as much as it used to be. And so, So, and it's important to know that there's bidirectional arrows here, because what we can think of then, it's also well known, like if you go to a therapist, they can challenge your behavior. So if you're someone who's depressed, people who are depressed tend to lie on the couch a lot, and they don't go out to parties, and they don't go out, and they tend to be reclusive. And so the therapist might tell them, well, just get out more, And often if you just sort of force yourself to get out there a bit more, you can sometimes counteract some of the depression. So what about meditation? So again, if you think of meditation as a behavior, right? So when you sit and you're training your attention, that is a behavior. So can we show that the behavior of meditation changes brain activity, that changes brain structure, and and then in return can change your behavior? That's the idea of what we think. This is what we mean by neuroplasticity. If you can somehow change your brain structure, you can change how your brain works and the behavior of your mind. So that was our starting hypothesis, is that because when meditates, sorry, I'm jumping around a little bit here. I don't usually give a 20-minute talk, so I usually have a longer preamble. So I should have mentioned is that, of course, when you sit and meditate, it feels great, right? And you feel relaxed. But then you get up, and all the rest of the day, you feel that during the rest of the day. So it's not just while you're meditating, it's during the rest of the day. So as a neuroscientist, to me, that means that somewhere in your brain, something has changed, right? That's the behavior. So your brain is no longer stressed all day long. So somewhere, somehow in your brain, there must be something different. And so that's what we set out to do. Can we show that when you meditate, can you change your brain structure, change your brain activity, and that this is then related to why you feel better and your symptoms go away or become decreased. So we recruited 20 people here in the Boston area who regularly meditate, and they do this insight meditation, and we put them in the MRI scanner, and we said, okay, lie there and do nothing, and then we said, begin meditation. And we looked at their brain activity during meditation versus during rest. And what we found was that these three brain regions became more active specifically while they were meditating, okay? So this gets back to they're not just spaced out. There's something very specific happening in their brain while they meditate, okay? And these three regions together, the insula, the temporal pole, and the cingulate, are well known to interact with each other. And together, they are referred to as Paralimbic Cortex. And I won't go into why they're called that. But basically, they connect the limbic system, which is sort of the old kind of more primitive part of your brain, and the more emotional part of your brain, with the cortex, which is sort of the more elegant thinking part of the brain. And so you can sort of think of the cortex as sort of like the thinking part of your brain, like the mind part of your brain, whereas the limbic system is, sort of your visceral reaction. So that's sort of more the body part of your brain. And so this regions literally connect sort of the brain to the body parts of your brain together. And so you can think of this in a very loose way as the mind-body connection, maybe. And what's interesting is that these regions are implicated in numerous diseases like depression and bipolar disorder and anxiety disorders. These regions are the regions that are off in people who have these disorders. And so it's interesting that these are also the regions that are engaged during meditation. And it suggests that these are the regions that are somehow, that you're paying attention to this mind and body, and you're seeing the integration of your mind and body, and that it's helping combat these mind states. We also found that the amygdala is less active. And the amygdala is the fight or flight part of your body, right? So you're walking in the woods and you see a snake out of the corner of your eye and you go, ooh, right? That's your amygdala going, ooh, wait, hold on, alert, watch out, get more information, and get you in primed, ready to run. That's your amygdala. And so during meditation, it gets turned down, right? And so this is consistent with this idea of while you're meditating, sort of feeling relaxed, feeling good about yourself. That's your amygdala. Okay. So now what about brain structure? Can we show changes in brain structure? So this is just sort of to transition us. So often when you, in the newspapers, you'll see pictures of brains with yellow blobs on them. And usually those yellow blobs represent brain activity, right? And so you put someone, like I just showed you, that was brain activity. We had them lie in the scanner and do nothing and then meditate. And so it was changes in what their brain was doing between the two different conditions. However, we can also look at the structure of the brain. So we can actually go in and so see these red and yellow lines. You often hear like white matter and gray matter. So the gray matter is this little thin strip of brain between the yellow and the red lines. And we can actually go in and measure how much gray matter people have. And we show this the same way. So these yellow blobs that you're going to see in the next few slides represent areas of the brain where there's more gray matter, either before or after, there's just more gray matter. I'll just put it that way. And just so you don't get confused, because the pictures look the same, but they're showing different types of data. Okay. So other people have shown, for instance, that if you speak two languages, the language areas of your brain have more gray matter. And for instance, musicians, professional musicians, have more gray matter in the areas of the brain related to music than amateur musicians, and they have more gray matter than people like me who have zero musical ability. And what they've shown is that how much, a lot of different studies have shown that basically the more you use a part of your brain, the bigger it gets. And the idea is, and that's why you're better able to do that, because you have more brain cells doing and acting on that and working on that task, and so you're more proficient at it. There's also one study where they took people who had never ever juggled before, and they taught them how to juggle. Well, first they scanned their brains. Then they taught them how to juggle, and they said, okay, keep juggling. And they told them to keep juggling for every day for like 20 minutes a day for 3 months. And then they scanned them again. And what they found was that these areas where the yellow blobs are grew. And this is an area of the brain that's involved in detecting motion. So, as your eyes do that, this is the part of your brain that allows you to do that. And what they found is that from before learning how to juggle to 3 months later, this area grew, right? And then they told them, stop juggling. They brought him back 3 months later, and that area, it didn't go back to baseline, but it did, so this is the use it or lose it, right? If you stop doing something, your brain will lose some of its ability to do that. So in a way, it's a lot like muscles, right? If you start pumping iron, your muscles are going to grow. You stop, you're going to lose the muscle mass. Same with your brain, okay? So this really shows us that even after a very short period, your brain can respond and your brain will do things, will grow in response to what you do. So we took these same people we did before, the 20 people who had been practicing meditation for many, many years, and we looked at their brain structure. And what we found is that these brain regions, and here in yellow, were bigger compared to people who had never meditated before. And the primary area we found was this region, which is called the Insula. And this is one of the same regions I showed you before, one of these paralimbic regions. And again, it's one of these regions that's involved in integrating the mind with the body. And specifically, it's awareness of internal sensations. Like when you're feeling hungry, that's your insula. Your heart rate, your breathing, all of those, that's your insula lighting up when you become aware of these things. So it makes a lot of sense, since these people spend a lot of time aware of their breath, that should be the primary area that would grow, because that's what they're doing, right? They're spending 45 minutes a day watching their breath, so that's the brain that area should get bigger. But what's interesting is that it's also involved in a lot of other things. So for instance, it's also involved in recognizing other people's facial emotions and empathy, right? And it's also thought to be part of this idea of me. Again, when you think about who I am and that, the insula is involved in these sorts of ideas. It's physically smaller in schizophrenic and bipolar patients who have a lot of trouble with these, with identity. And there's also very altered in anxiety patients. The other region we found was here in the front of the brain. And this is an area that's very important for working memory and attention. Also with emotion, cognition, interaction. And that is, like, when you're anxious and you find it really hard to pay attention, and even if you hear something and goes in one ear, not the other, versus if you're relaxed, you can take information a little bit easier. That's an area of the brain that's sort of mediating that interaction. And we won't go into the moral decision making, that's sort of hard to explain. The other thing that was interesting, it's long, it's just a short talk. Anyways, and so the other thing that was really interesting about this finding was that in this one particular part of the brain, what we found was that, so it's well known that as we get older, our brains shrink, right? This is why as we get older, it takes a little bit longer to remember where we left the keys, or what was that person's name? Oh yeah. And that little bit of slowing down that happens as we get older is because our cortex is literally thinning. And so here in red are the control subjects, the people who had never meditated. And this, again, has been very well documented in many studies that, when we're 25, it's all nice and thick. And then as you go 40 to 55 years, when you're 45, 50, you've already lost a tiny bit, millimeter, less than a millimeter. It's 0.2 of a millimeter. It's a tiny amount. What was interesting was that in this one region here, circled in green, that the 50-year-old meditators, had the same amount of gray matter as the 20-year-olds. So it suggests that by meditating, we can sort of prevent some of the decline of that's happening in our memories. And again, it's a very small region, but there's other regions of the brain. This is the only part of the brain where this interaction was significant, but there's other parts of the brain where there was a suggestion of it, but it wasn't quite statistically significant. This is also a pretty small study, but it's suggestive. But okay, the critics always say, well, meditators are weird. Maybe their brains were like that before they even started, right? Maybe it has nothing to do with the meditation, right? Or maybe it's because they take 40 minutes out of their day every day just to sit and meditate, Or maybe it's like, lots of times those meditators, they're vegetarian, so maybe it's because they eat different things, right? And I get this a lot, right? And in truth, all of those, they're all very legitimate criticisms, right? It could be any of those things. So we did another study. Where we took people who had never, ever meditated before, and we put them through one of these 8-week meditation programs. And then we scanned them before and after. And then we compared them to people who were interested in taking the class, but who were on a wait list. So people who, they signed up and we said, okay, there's no space in the class right now, but you can take the class in 2 or 3 months. And so then we would scan them then, and we'd scan them again 2 months later, right before they went into the class. And all these people were stressed, but otherwise healthy. And what we found was that in just 8 weeks, we could find that part of the brain actually grew, right? And so specifically, we found that the hippocampus, a region called the TPJ, and the PCC all got much bigger in these people from before to after this 8-week program. The insula, which is that big spot I showed you before that was bigger in the long-term practitioners, that also grew a bit, but it wasn't quite statistically significant. And we think that has to do with, lots of times people say that when they first start practicing, certain things happen, but then as they practice more, they get better at it, and it changes a little bit. And so we think that with practice, it changes a little bit, and so that's why we get slightly different brain regions after just 8 weeks than we do after many, many years of practice. So now the hippocampus is involved in learning and memory, and again, it's well known to be very sensitive to stress. So if you stress out animals, oftentimes the hippocampus shrinks. The TPJ is involved in perspective taking, which means being able to see other people's point of view. And that's really important for empathy and compassion, right? Because if I can see your point of view, then I'm less likely to get angry at you, right? Or to be able to forgive you because, oh, I see, I understand why you did that. The PCC is involved in self-processing. So again, like when I walk down the street and I see something, it's like, oh, I would look great in that jacket. Oh, I wonder what, how does that relate to me? The PCC is doing that. It's sort of taking in information, always saying, is that piece of information relevant to me? Do I need to remember that? Do I need to know more about that? How is this relevant to me? That's what the PCC is doing. The other thing we found, which was really interesting, was that part of the amygdala literally shrunk, right? And this is where we get back to behavior. What we found is that this change in the amygdala, which again is this fear and the fight or flight part of the brain, go back, was correlated with the changes in stress. So the more the people said, I feel less stressed, the more their amygdala shrunk. And what's really cool about this is that the same part of the amygdala has been shown, they did a study with animals and happy little rats running around their cages. They then took those rats and put them in another cage and they stressed them out. They shone bright lights and lots of loud noises and the animals were very unhappy, right? And then they put those animals back into their cage. And so the stress went away, right? They're back, but the animals still acted stressed out. And what they showed was that part of the amygdala got bigger when they put them into the stressed out cage, and it remained big even when they got put back into their happy cage, right? So the amygdala is correlated with their behavior, right? So they're stressed out, their amygdala gets big, even though their environment changes, they're still stressed out, the amygdala is big. Whereas here, with these humans, they still have their stressful lives, right? They still have their stressful jobs, they still have all the difficult people in their lives, but their relationship to them has changed, right? So they still go to their stressful jobs, but they're not feeling stressed out anymore. They're feeling relaxed about their jobs. And so the amygdala is reflecting the behavior, right? And so this sort of gets and helps us understand that meditation is really working, right? So when you meditate, your amygdala turns down, becomes less active, it shrinks, and so therefore when you then go out into your stressful lives, you're just not going to respond in that same way that you did before. Okay, almost done. Okay, so then this is my favorite study. In this study, it was a double-blind study. It was psychiatrists in training, and they were learning how to become psychiatrists. And the person who's in charge of their training said, I think it would be useful for you guys to learn how to meditate. So he split them in half. And so it was 18 therapists, and he randomly said, okay, this half, you at 9, you're going to learn how to meditate in June, and then the other guys, you'll learn how to meditate in July. And they were therapists at an inpatient hospital, right? So a mental facility. And so the therapists continued to give standard treatment, right? And so they weren't teaching their patients how to meditate. They weren't doing anything differently to their patients, but just they started practicing meditation. And no one knew there was a study going on, except for the person who decided to do the study, right? Who had trained them all. And what he found is that the patients of the therapists who were trained had better outcomes than the patients of the therapists who hadn't received the training yet, right? And what this suggests is that, again, because we know that being able to see other people's point of view and being less calm and less reactive, that by the therapists meditating and becoming less reactive and more compassionate, their patients had better outcome, right? So the implication is that by us meditating, we will become more compassionate and we will have impact on the people around us. And that's, there's been a couple little tiny studies with monks sort of showing that monks can, people who are kind of mean and surly, and just the monk being calm and serene makes other people sort of chill out a little bit. So you can change the people around you by you meditating. Okay, so the take-home message is that meditation can literally change your brain. And so now for those of you who want to start meditating, there's a couple places here in Boston. Also, you can look in the yellow pages under yoga or meditation, and there's a whole bunch of places. And so if you want to just go give it a try, I highly recommend it. Thank you.
Thank you, Sarah. As we're transitioning over to Dr. Miller's presentation, I just wanted to just let everyone know that our staff is walking around with note cards, and that's intended so if you have questions, please write down your questions, and then when we have our Q&A session at the end, we'll use those note cards to have our to help facilitate the Q&A session. So it's my pleasure to now introduce Dr. Michael Miller. As mentioned before, he's the assistant professor of psychiatry here at Harvard Medical School and has been on faculty for more than 30 years with the Beth Israel Deaconess Medical Center. He's a teacher and a supervisor within the Harvard Longwood Psychiatry Residency Training Program. And he has consulted and lectured widely on topics on various topics ranging from medical ethics to sex education to dealing with the risk of suicide and violence. Some of you may have seen Dr. Miller in the public arena as he's appeared on the Today Show, the Martha Stewart Show, amongst many other sort of national and local broadcasts. Dr. Miller now devotes the largest proportion of his time to educating the public about mental health and mental wellness through writing and speaking. So with that, Dr. Miller.
All right, that'll work, I hope. I have to say that it was a great irony to be on the Martha Stewart Show. This was a couple of years ago, and it was right after the big downturn in the market. And, of course, Martha Stewart had her yeah, I will. Her famous problems with investing and went to jail for that, so that was a little peculiar. But here I was on this program trying to talk about stress, and I was as nervous as I've ever been in my life. It was a little ironic, and I have to say, I don't know if you can see that, but this is the quad at Harvard Medical School, and it can look very beautiful sometimes, but it is not exactly the least stressful place to work. And often when I'm here, I wish I were there. Stress, a lot of the things that I'm going to try to give a kind of, we've heard a lot about the science, which was terrific from Sarah and Darshan, and I'm going to try to focus a little bit on some practical things, maybe even some little bit of advice at the end. And, perspective is important. In the front is my 7-year-old niece, and in the back is my 22-year-old son. Even though he looks smaller, you don't want to mess with him when he's close up. This is really the whole point of my talk and maybe of the evening, which is pay attention. If there's anything, from my talk that you take away, this is the thing. Now, you see here brain on the left and the heart on the right, anatomically perfectly correct. And I just want to pose a question, maybe a show of hands. People talk about, do they feel with their brain or do they feel with their heart? So how many people think they feel with their heart? Okay, and how many people think they feel with their brain? Okay. Well, sorry to embarrass the people who said they feel with their heart. That, of course, is a metaphor. Everything we feel with our brain. The heart is simply a pump in the chest. It makes the blood go around. It's a complicated organ, but as I like to think, it has nothing on the brain. I mean, the brain is the most complicated organ in the body. I think of it, for Star Trek fans, that's really the final frontier. And we're learning a lot about it, and you saw some of these great pictures, which I love looking at too, of brain function. But what we've learned from these studies, and not just neuroimaging, but genetic studies and neurochemical studies, we have only scratched the surface, begun to scratch the surface of how the brain works. Let's start with just some practical definitions, ones that we can all relate to, I hope. So what is stress? Stress is really an automatic physical response to anything that requires you to adjust, to change. Any threat, whether it's real or perceived, can trigger a cascade of stress hormones. This is, flows out of the brain. It happens very quickly. A complex series of, one hormone triggers another hormone, triggers another hormone. There are feedback mechanisms. There are all sorts of changes that go on. When you are frightened by something, your heart, people are familiar with this, your heart pounds, your muscles tense, your breathing gets faster, and you begin to sweat. And it's good. It's a good thing. It's good for survival. It's an evolved, built-in protective mechanism that our ancient ancestors evolved, and really every mammal certainly has this kind of system. It helps us avoid or deal with danger. And you may have heard of the fight or flight response. If you happen to be walking along down, in Central Square, going to the Zen Center, and a bear jumps out, you're suddenly going to become hyper alert, and you'll be ready to either run like mad, which is the flight, or confront the bear. I personally recommend running. Now, it's great if you're hiking and a bear comes along, or you cross the street on a busy city street and you see a car out of the corner of your eye and you react quickly. That's fabulous for survival. But at work and at home, we usually aren't confronted by these kinds of dangers. Most of the dangers that we experience day to day are psychological ones. Is my boss happy with me? Is my wife or my husband or my children happy with me? I just got the bank statement and there's less there than I thought I had. And of course, the one that many of us deal with is just too much to do and not enough time to do it. And for some of us, where it becomes maladaptive or not very productive, is that this stress response gets stuck in the on position. And this is, in recent months and really for years, but for reasons I don't quite understand in the last couple of months, maybe because of the social network, there have been a lot of articles about how the internet is affecting us and how, I've got an iPhone, an iPad, a Mac, a Kindle, 15 iPods, I am just addicted to this stuff, and it is not exactly a recipe for mindfulness. Now, some stress is good for you, in the survival piece, but it also helps you grow. If we're not challenged, we don't grow. We're pushed. We learn things. We learn new things. It's why we go to a coach. It's why we go to a teacher. The whole notion of mindfulness, they talk about it as a practice. So one practices meditation. Also, one of the principles that Sarah hit on, which is very important and goes back to that slide about the brain versus the heart, is that anytime anything happens, any growth really is correlated with some change in the brain. As I'm talking to you, as you're listening to me, there are things that are happening in your brain, and the brain is changing all the time. When I went to medical school, which was a lot longer ago than Darshan, who kindly told you I've been on staff for more than 30 years at Beth Israel. We kind of learned that when you're born with all the brain cells you're going to have, the genes, the dice have been rolled, and you get what you get, and you don't get upset. You may grow until you're about 18 or 20 or 25, and then it's all downhill. Well, we saw evidence today that it isn't. The reality is that, the brain can continue to grow and change, and it's really, it makes sense. How could it be otherwise? But it seems like a new insight that in fact the brain, when you use it, it changes, and when you practice, the areas of the brain where you're practicing change. So, and the way this happens, they call it neuroplasticity, which is a fancy term for changing the brain. Neuro and plastic is not just something, since I'm old enough to remember The Graduate, right, plastics. If you don't know the reference, you should see the movie. Literally, there's an increase in branching and sort of the connections between nerve cells change. They get stronger, more robust, and the nerve circuits actually become more efficient, which is why the juggler gets better. And again, people talk about muscle memory. I play the piano and I can juggle also. I won't do either of them tonight, but don't ask me about moral judgment. I'm less certain of that. But, any of you who have experienced an activity, golf, tennis, playing a musical instrument, certain things become automatic. And they become automatic because with practice, your brain, practice is actually in all sorts of places in your life a kind of mindfulness. The best kind of practicing of the piano or of juggling, you can't really slow down when you're juggling because of gravity. But you can slow down a musical phrase as slow as you can to play it. And your brain literally lays down those, the wires get stronger, the circuits get stronger. All right, so stress is great for some things, but if it's always on, not so much. Now, I was asked to talk about stress in the heart, and I urge you to think not just about the heart, but this heart is kind of a case in point. What we're learning is that everything is related to everything else in health. And so brain health and heart health are actually quite allied. And the things that are good for the brain tend to be good for the heart. And that's an important thing to keep in mind. So stress, which is also bad for the brain, and we heard about how it can cause anxiety and depression and all kinds of things that don't feel good, also can harm the heart. One thing that happens with stress is that we perceive ourselves negatively, and so we take care of ourselves less well. We also are more likely to do things like overeat, smoke, pay less attention to the kinds of things that we think of as in the broad category of eating your vegetables. Your blood pressure can go up, your cholesterol, triglycerides can go up, you can gain weight, etc. But separate from the whole issue of lifestyle, which is quite important, which every time you see your primary care doctor you're probably reminded of, the biology is very interesting too. What we find is that under stress, the heart rhythm becomes less flexible, which can make people prone to arrhythmias, heart rhythms that can literally cause sudden death. The platelets, which are needed for clotting, become stickier, and so they can cause those clots, which can clog blood vessels that supply the heart and cause a heart attack. Your blood pressure can go up, and also there's all sorts of evidence that inflammation throughout the bloodstream goes up, which also can cause clotting and leads to things like atherosclerosis. Now, some of you, as I look around, like me, are old enough to remember the type A personality. People remember hearing about type A? All right. This is supposed to be somebody like the typical Harvard faculty member. Ambitious, aggressive, all business, controlling, competitive, impatient, status-driven, time-conscious, and tightly wound. I'll tell you, it's really a great place to be. But unfortunately, that type A construct is completely irrelevant. So, and there was a type B, and the type B was supposed to be the opposite, kind of a calmer person. Type C was a kind of a cancer-prone personality, but it turned out studies in the 80s sort of debunked this whole concept. But more recently, thanks to a Belgian researcher who's been prolific, really, in the last 10 years. His name is Johan de Nolet. I had a chance to talk with him a few years ago to write an article on this for Newsweek. Came up with this thing called the type D personality. I mean, it made sense, ABC, what's going to come next, but it stands for distressed. And he had this idea that he was working in a hospital in Antwerp, in Belgium, where he noticed that, he saw all these patients with cardiac illness, and they'd have their heart attack, and they would have this, great positive outlook, and others would be kind of grouchous about it. Now, I mean, bad heart disease is bad, and people are entitled to be grouchy, but he was sort of stunned at some of the differences. And he came up with this construct, this type D personality, which was a combination of negative affectivity. Affect is a fancy word that psychiatrists and other doctors use to mean really emotion, the expression of emotion. These are people who are worried, irritable, and gloomy. And social inhibition, that, combined with the negative affect, is this reticence or lack of self-assurance. And he came up with a scale called the DS-14, or the D scale 14, where it's a 14-question questionnaire, and to determine who has this type D personality and who doesn't, and these are some of the items. And what he found was, in studies that I'll just summarize for you in a second, is that people with type D personality in the context of cardiac illness were more likely to die. They had an increased risk of developing cardiovascular problems after a heart attack. They had a poorer response to proven treatments for heart disease. They had an increased chance of sudden cardiac arrest. They were less responsive to treatment overall, and they had a poorer quality of life. Now, my view is that bottom factor is the most important one, because no matter how long you survive, and except for me, I mean, all of us in this room, I think, are probably going to live forever, but most people out there, eventually, we come to the end. But the point is, while you're living, you want to be able to live as well as possible, which is a pitch for the next session, of course, living well, better, and living longer. Here's an example. 300 patients in a cardiac rehab. How many died within 10 years? People who did not have the type D, 7% had passed away within 10 years. The people with type D, 27%. Pretty dramatic. 875 patients who were given a stent, the device that holds the artery open to supply blood to the heart. How many had a heart attack or died within 9 months? People without type D, 1.3%. People with type D, 4 times more. And this is, the D scale also picks up these other general concepts, anxiety, hostility, hopelessness, that are linked with bad outcomes. So the question is, and there really aren't great studies about this, and because they're so hard to do, but again, quality of life, if we can control our stress, and this is what the mindfulness meditation and other relaxation approaches do for us, is can we control our stress? And now we're getting back to the key point, and you all are paying attention. It's a beautiful thing. The object is to try to manage your stress. And here are the tips that I told Martha. This was really talk about. So once I got going, I was fine. You can see this online. I look as if I wasn't a bit nervous. Not true. But we're talking along, and we're talking about what the things you can do to feel less stressed. Just, you know what I do when I'm feeling stressed? I throw a dinner party. Like last Saturday night, I had 20 people over, and we had so much fun. I don't know about you, but that doesn't sound like a stressless evening to me. But All right, so one of the things that we get overwhelmed with is this long list of things to do. So one thing you can do is, you know, when you have a long list of things to do, one of the problems that comes up, I know it happens to me, is I can't do the one thing because I'm thinking of I do this one thing and all I can think about is all the 100 other things that I'm not doing. But if you can get yourself to try not to do everything at once, but just do the next thing on your list, or, you know, there are all sorts of systems that you can use, read about. One thing at a time, if you can do it, and again, paying attention helps you do that, because if you can really focus and train yourself to pay attention to the one thing you're doing, that will be helpful. Use the meditative techniques, so I don't have to go further. Find a creative outlet. You know, piano for me, music in general, reading, writing, these kinds of things I find much more engaging, for instance, than going from YouTube video to YouTube video. I mean, that's engaging too, but in a different kind of way. Be social. So, relationships do help. This, I think, is where Martha Stewart chimed in about the dinner party. I say, one person, go out to dinner, have people over to, you know, watch a video or something. And finally, develop a routine. Again, this gets to practicing. If you don't have to make it up every day, it's easier to do. There's also, interestingly, as I was preparing to talk there, in the last couple of days in the New York Times, there were a couple of articles that talked about this. One that we were talking about before the talk, a paper that was published in the Archives of Internal Medicine just yesterday from Duke, which for us people who think we're in the center of the universe is in North Carolina. They looked at 2,800 patients with heart disease. The ones who were more optimistic, they did this questionnaire at the beginning and followed them prospectively over time. The more optimistic patients survived longer. Now, the important thing that is talked about in the paper, and I will underscore this, is that it's not an optimism that's, oh, everything's going to be fine and therefore I don't have to worry about anything. These people were realistic. They were optimistic, though, that if they stuck with their program, that they would do better, and they did. The other, which is not so much a recent study, but a blog post that was in the Times today, talks about self-compassion, and this is they interviewed this psychologist, I think, in Texas at the UT Austin, which I haven't spent a lot of time in Texas, but Austin, for musicians, is supposed to be fabulous. So maybe people are happy there anyway. But the studies show that self-criticism and negativity about yourself makes it much harder to change. People who are critical of themselves have a harder time sticking to a diet, sticking to an exercise plan. All right, so just to wrap up, here are a few pieces of advice that I was thinking about late last night. One is to be motivated by the biology. I had an opportunity to look into a related but different topic about the effect of exercise on the brain. And you may not know this, and people talk about exercise as a treatment for mild to moderate forms of depression. But if you exercise every day, it doesn't have to be a lot, your brain will actually grow. The parts of your brain that actually help you with stress reduction and mood actually change. Like it's the equivalent of your muscles getting bigger. Now, I hate exercising, and it's so easy for me to blow it off. But there was something about the idea that, wow, this really is going to change my brain. You know, at Harvard you can get into that. You know, the idea that, you know, you're actually going to change your brain structurally through exercise is kind of a motivating thing. And it gives you the feeling that, okay, if it's going to take me a half hour or take an hour out of my day, I'm actually going to get that time back and more, which actually turns out to be true. The other thing I would say, and this is, again, related to mindfulness, is that it's very hard to make big changes. Never mind, the concept of Rome wasn't built in a day. But I would urge you to focus on small changes. I have talked with patients of mine over the years who have trouble with substance abuse. And one of the concepts that, scolding doesn't help. Scolding doesn't help to change your diet, doesn't help to change your exercise pattern. But if you think of all the little choice points in your day and you say, well, if I actually pay attention to this and think about it, and I make this choice, I know it's going to go in this direction. If I make that choice, it's going to take me down a bad road. Which, with people who are recognizing that they say have a problem with alcohol, they can actually relate to, and it's also the one day at a time concept, but this is really less than one day at a time. It's one moment at a time. You have an impulse, you recognize it. You can actually maybe make a choice if you pay attention. And this is my pitch, that really mindfulness is no more complicated than the concept of paying very close attention. Paying close attention to the choices you make, paying close attention to how you practice if you want to learn the piano or play tennis, to pay attention to what's on your list and really focusing on it. If you do that, then maybe you can do things that seem impossible. That is a real picture. That's not photoshopped. All right, so I'll stop there, and I guess we'll do the Q&A.
Okay. So we have a lot of questions here, and we'll try to get through as many as we can in the time that in the brief time that we have. But as we're kind of just getting settled, let me just answer. There's a practical question. Will these presentations be made available online? The answer is yes. They are recorded, and they will be on the website. Okay. So let me just begin. First question. This question is for Dr. Lazar. Dr. Lazar, you had put people doing mindfulness meditation in the MRIs. Have you done the same with people who practice other forms of meditation, such as transcendental meditation?
Yep, I get this question a lot. We've not studied transcendental meditation, TM, specifically. We've recently did a study with yoga practitioners. And actually, this is another question I get a lot. People lots of times will say, oh, I just practice yoga. I don't meditate. And when yoga's done right, yoga is meditation. And what our data shows, we haven't done a pre-post study yet, but the long-term practitioners of yoga have very similar brain activity as people who are long-term meditation practitioners. So it seems like although they seem very different, sometimes yoga in gyms is a little not very meditative, I would say. But when you really have a good yoga instructor, that it really becomes meditative, and it does produce similar brain effects as meditation. And we suspect that although different types of meditation will have slight differences, that probably many of the benefits will be the same in the brain and have similar effects.
Great, thank you. Dr. Miller, why are all of our feelings and emotions created in our brain, and yet we feel them in places such as in our heart or in our chest?
Is this, people hear me okay?
Yeah.
The reality is that everything runs through the brain. All of our perceptive apparatus is in the brain. So when you if you touch something, you're going to feel it in your fingers, but it's your brain that's perceiving that, and it's the same kind of thing. That the emotional processing is actually very complex, and it also feeds back to you can actually feel indigestion, or you can feel butterflies in your stomach. A friend of mine also said that this guy who's a very successful businessman, and I was trying to explain this concept to him, and he says, I don't get it because I feel it in my gut. And, but really it's your brain that's perceiving what's going on in your gut, in your heart, in your arms, I mean, it is it's a funny concept to run your mind around, but it's one worth considering. You know, this idea that is there any other logical place where you could actually process these feelings and thoughts? And I mean, I come down to the brain as really being the only place.
Great. This is a question, I can answer this next question. It says, since brain activity can change behavior, does that mean that there is change in the gene expression? And if yes, does the changes pass on from one generation to the next? The answer is actually we just don't know yet whether, as I showed in one of my slides, there are gene expression changes and how these gene expression changes correlate with changes that are happening at the level of the brain. So this is actually, we're right at sort of groundbreaking research that is ongoing to better understand that.
I mean, there is actually evidence that when these changes are actually mediated at the genetic level, that when you exercise, for instance, genes get turned on and off that produce proteins that then downstream create the opportunity for the nerve cells, for instance, to make connections with one another. So that is kind of the place where a lot of the action is happening, but absolutely correct. We really are just scratching the surface of our understanding of it.
Yep. The question here, does it matter what time of the day you meditate? And either of you can answer that.
No one has really studied that yet. A lot of people like doing it first thing in the morning because the brain tends to be a little quieter in the morning. You know, when you come home from work, and so, but a lot of people like that too because then it helps them calm down. And so I would say the better answer is try different times of day and whatever seems most effective for you, because probably, you know, what's best for me may not be what is best for you. So just try it and see.
Dr. Miller, are some people bound to be depressed regardless of how much meditation they practice?
It certainly seems that way, doesn't it? You know, you know, from personal experience, just myself, people I know, people I have worked with in my practice over the years. I mean, this is one of the toughest questions, and goes to this kind of debate in our society about do we want to manipulate the biology by using drugs, for instance, or do we want to do a talk therapy or some kind of experiential thing like meditation? I mean, and the reality is that if the treatments work, they have to work because they're actually changing the brain. So that's an important concept. But there are a number of factors that go into it. You certainly, what I learned again, you know, 35 years ago about genetics is still partly true, because, you know, you do inherit a certain predisposition. But then the experience that you have early in life and throughout life has an enormous impact on how it turns out. So that even if you take two identical twins, if they have different experience, often they have the same experience because they're brought up in the same family. They're not actually identical. I mean, there's some twins you can't tell them apart, but people, you know, if you know twins, as you get to know them, you see there really are differences. They're not the same person even when they're 2 years old. So it's really a very complex combination. And my view of it is that it's important to keep an open mind. I mean, number one, it's more hopeful to think that you can change, and you know, the reality is that there's so many approaches to, if somebody is depressed long term, there are so many approaches to treatment now that we're really, you know, at the best time in human history to try to approach the problem, and, you know, to keep an open mind.
Just to add to that, the other thing to remember is that this doesn't work overnight like that, and all of a sudden, the world has changed, and everything is, and your depression's gone overnight. It's going to take time. It's a very slow, gradual change. And also, but it's really interesting, and there's this growing idea, though, that depression and happiness are maybe not, it's not a continuum, that they're sort of a little bit different. And so I can feel better about myself but still be depressed. And so you can have this positive, growing positive outlook even though you have the underlying depression. And so, because even someone who's depressed can laugh at a joke, right? And can be happy at times even though they're depressed. So if you, and it seems like the meditation's sort of helping the positive, which then gradually counters the negative, the depression. So it's a slow process, it's a complex process, but it does seem to help with depression, but it's not an overnight, oh my God, I'm no longer depressed anymore.
There are a whole series of questions on whether these mind-body approaches have sort of impact on specific medical conditions. So I'm just going to, the ones that have been questioned, there have been questions on Asperger's syndrome, addiction, bipolar disorder, seizures, and epilepsy. And so just to answer the question, we actually are, these studies are just we're at the beginning of understanding how mind-body approaches can be used in specific medical conditions, and really the data around this is quite preliminary, and with many of these conditions, actually, I don't believe they've been studied that extensively, but I don't know if you had any insight on specific medical conditions where we have sort of conclusive data.
Well, I can't really speak to medicine broadly, but at least in terms of things like depression, bipolar disorder, Asperger's, the notion of a mind-body approach, my feeling about it is that, things like mind-body, lifestyle changes, exercise, the beauty of these things is that they have virtually no side effects. So there's no harm in trying, really, and the ability of some of these changes to have an impact on a disorder really depends on how severe it is. In the same way that depending on how big the cut is, you might need stitches, or you might let healing happen on its own. But there are some disorders, just like, if you break a leg, you're probably going to have to go to the doctor to have a cast put on. There are some disorders which really are very hard to treat without some kind of biological intervention. And the problem, of course, is that there's, even on that side, there's no guarantee that you're not going to get side effects or that you're going to have improvement. But again, you're always weighing the costs and the potential costs and benefits of these treatments. So I'm not sure I answered that question, but my feeling, again, bottom line is that meditation is not going to hurt, and it can help anyone who's willing to kind of devote the time to it.
And just as a follow-up, so in England, a couple months ago, they've declared that meditation is now one of the primary treatments for depression, because they've shown that it is as effective, not as effective, but it's more cost-effective actually than medication. And there's been enough studies they feel that for major depression at least, that meditation is a first-line defense or first-line treatment for depression. But that's the only disease other than stress. And again, it's symptom reduction, but not symptom eradication.
Dr. Lazar, how is it that these approaches allow thickening or growth of the brain? Is it increase in number of cells, or are there other processes that are involved?
Right. So the only part of the brain where we know there's new neurons is the hippocampus, and that was one of the regions we found. And so in the hippocampus, there is new neurons. The rest of the brain, as far as we know, no one has ever shown new neurons. And our technique doesn't allow us to go in and check, but what we suspect is happening is just that there's more connections between the cells, and so there's more branching, and so it's just growing. And as Dr. Miller said, there are other things that help your brain grow. So exercise can also help your brain grow. You know, if you never played an instrument before and you suddenly started playing an instrument, the music part of your brain would start growing. So it's not so much the growth that's interesting about the meditation, but more where in the brain that's growing. And then that these changes are associated with these changes in stress. So that was sort of what's sort of interesting about it. But so it's probably, we think it's probably just more connections.
Great. Okay. Dr. Miller, how does, I guess this is a follow-up question to, or maybe related to an earlier question, are our personalities fixed and can they be changeable?
Personality.
Are our personalities fixed as it relates to stress reduction, or is it can they be changed through these approaches?
I just got back from California, where I was at a 3 or 4 day conference where it was all about personality, and one of the problems, of course, when you talk about personality is how do you separate personality from all these other qualities, mood, irritability, energy. Again, I think that, rather than getting into kind of a complex discussion about personality, I think the simplest way to answer it is to say, yes, I do believe that, I do believe that people can change not just symptoms. I think Dr. Lazar was talking about it, that, rich experience in life depends on not feeling dulled, but on being able to feel a range of feelings and to tolerate them. And so, for instance, one of the problems that we may have is not that we're anxious or that we're depressed, but that we have trouble tolerating it, and that we behave in ways that are self-destructive, let's say, in response to feeling anxious or feeling depressed. So if you develop ways to manage the feelings you have, and you behave differently as a result, it will look to the outside world like your personality has changed. And so I like to be practical about these things rather than thinking about the labels, because it's so hard. Right now, there's hundreds of psychiatrists debating what the new diagnostic system should be, and it's an interesting process and it's a necessary one. But I'm Jewish, and so I can say this. There's an expression: 2 Jews, 3 opinions. 100 psychiatrists, 1,000 opinions. It's really difficult. But my feeling is that we're not suddenly going to wake up. You're not going to suddenly wake up and be Brad Pitt, or not that that's necessarily a good thing, but you
Or Charlie Sheen.
What's that? Or Charlie? Yeah, that's right. There you go. Perfect. Wish I'd thought of that. But this is the way I think about it. I think it's possible to make 1%, 2%, 5% changes in how you feel and who you are. And that doesn't sound like a lot, but often that amount is the crucial difference between having a life that is satisfying and comfortable and one that is frenetic and distressing. So, we're trying to work with things around the margins, and I think this mindfulness meditation, insight meditation, is one of those techniques that can actually help.
Okay, and then the last question, unfortunately we're running out of time, so several questions asked on, have these applications or interventions been done in children? Are they being done in the schools? Does it impact behavior? So I'll just start off. The answer is yes, they are being done in schools. There's series. Our institute, for example, is conducting studies on these interventions in the school systems. I know there are other scientists out there doing that as well. and they do impact children in health promoting ways, as well as sort of, we're looking at also learning behaviors as well. I don't know if there are quick add-ons to that as well.
Yeah, it seems like it increases resiliency. And so they're doing yoga in place of gym class, and they're showing that the student, and this is in high schoolers, but still they're finding that the students who are in the gym class, by the end of the semester, they're doing worse on these standardized computerized tests that we give them. And then, but if you're in the yoga class, you maintain and even slightly improve your performance on these tests. And so, because at the end of the semester, you're feeling stressed out from all the exams and whatnot. And so it seems like, again, like they're better able to handle the stress of being in school. But there's also talking to the students. They talk about how they're interacting with their peers differently. Like this one guy's like, yeah, I used to be kind of a bully, but I realized, that's not cool. And so he recognized that in himself, and he stopped bullying other people. And we're just getting some incredible self-report back from the kids about how they're seeing the yoga changing their lives. So it's really profound.
And I'll just make one quick comment. Just like learning tennis or the piano, the earlier you learn these kind of techniques, the easier it is to continue them as you get older, and it's safe to do.
Great. Okay, well, thank you very much. And
Thank you. Dr. Lazar, Dr. Mehta, Dr. Miller, thank you for taking time to be with us tonight.